The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, Kiko Auctioneers, and of course our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our guest from Aultman Hospital, diabetes educator, Mechelle Metzgar, which we've already decided the Beatles wrote a song about her. Okay, good morning. Welcome to the show.
I appreciate you having me here today. Thank you.
Patients with diabetes understand the challenge of managing the disease. Healthy eating, physical activity, regular blood monitoring, take medication, and reducing risk of complications. They are all necessary as part of daily living. Sometimes it can be overwhelming, but a diabetes educator can help. And today we're going to talk about blood sugar ranges, how to treat them, diet, exercise, and more. We'd like to remind our listeners today that our program is available on our podcast, which can be downloaded from the App Store on your mobile phone. You can look for Health Matters with the Medicine Center Pharmacy and take it with you anywhere you travel anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Mechelle, tell us a little bit about yourself.
Well, I have been with Aultman Health Foundations for over 8 years. I actually started with Alt Care in Prime Time, and I used to do a telemonitoring diabetic program over there. I transitioned over to the hospital side now, and I see patients in while they're admitted to the hospital and do education at bedside. And then I get referrals from physicians, case managers, without patients, and they come in and get education with me there. On a personal note, I actually have a type 1 diabetic son, so I live this 24/7 with him, too.
Okay. Now, how old is he now?
He's 17, and he was diagnosed when he was almost 8.
Okay.
Yeah.
Well, that's something interesting to grow up with and to really manage as going into adulthood, stuff like that.
Yes.
So do we know how many people in the United States have diabetes?
Yes, we do. So there are actually over 30 million in the U.S., but only about 23 million are diagnosed. So there's about 7 million running around that don't really know that they're diagnosed yet.
Somebody that I talked to yesterday came into the room and he said, I just heard this on the news. That the year 2030, there won't be any insulin. There won't be enough insulin for anybody.
Someone
mentioned
mentioned that a patient actually came into the office a few days ago and mentioned that to me too.
I mean, it's a little bit. I mean, I would hope by that time there's a solution.
Yeah.
I remember when I was on the board of Juvenile Diabetes Foundation, that organization had a goal for a cure for diabetes by the year 2000. Well, we didn't make it. So, and maybe it's worse now than it ever was. I don't know.
Yeah, I know we've done a lot more lately with insulin pumps and continuous glucose monitors. There's a lot more on board we've come a long way now just recently in the past few years with diabetes, which is a good thing.
And Americans don't seem to be willing to change their diet. Some do, but a lot of them don't seem to be willing to change their diet, which is,
Right, that's key.
Yeah.
So let's talk about blood sugar ranges.
Yes. So blood sugar ranges, if you are not diabetic, the ranges would be under 100. So American Diabetes Association gives that between 70 and 99. And prediabetes diagnosis is 70 to 125. Once they diagnose you, that is at the range of 126 for a blood sugar and over.
Sometimes I have patients that'll come in the pharmacy and they'll say, my doctor says I have a little diabetes. There's no such thing as a little diabetes.
No.
So can you speak to that? Because I think it's maybe, sometimes I wonder if the doctor is trying to break the news gently.
Yes.
With good intentions, but it's a serious number.
Yes.
So what do you think?
Yes, I agree with you there. I think that's where the patient should be more proactive with their physician and ask them what that would mean, what their numbers are. They have the right to know what their blood sugars are, and ask them to elaborate on that. And then go from there with getting as much education as they can to prevent, because that's key, is preventing it.
All right, so what about, it also could be, in all fairness, that people don't want to hear that.
Yeah.
Because it's scary. What about, so you mentioned normal blood sugar ranges. What if, okay, so once you're diagnosed with diabetes, what is the goal?
So, okay, so if you are diagnosed with diabetes, our goal is to get our blood sugars within the range of 80 to 130. And then sometimes, and that would be a fasting blood sugar or any time before meals. You can also check your blood sugar 2 hours after a meal, and they would want see those numbers, anything below 180. And that would kind of tell you how your activity, how your medication, what you ate, how your body is actually working to get under that goal.
Okay. What about low blood sugars, and how do you deal with those?
That is considered anything under 70. And they might have the symptoms of shaky, sweaty, confusion, weakness. They might be irritable. Everybody has different symptoms. And how you would treat those is some orange juice, 4 ounces, or I know you guys carry at the medicine shop glucose tablets. Those come in, and I don't know if you carry different flavors, but they have orange, right?
Yeah.
Orange, tropical punch, grape, different, but 3 to 4 of those. And I always advise my patients, don't chew them all, 3 or 4, because they're huge. They're like a quarter size, right? So, one at a time. And then you can also do an 8-ounce glass of skim milk, if that's what, because some people don't like orange juice. And you can also carry the little Brock's peppermint candies. Right now it's Christmas time, or Lifesavers in your purse. So it's real good for, ladies carry things like that around in their purse. We want this to be a fast-acting sugar because some people say, well, I'll grab a candy bar. We don't want all those extra fats and things that the body has to break down, and those other things are fast-acting. And always recheck your blood sugar in 15 minutes.
Okay. So we were just talking about, low blood sugars. We do have other things in the store too, like glucose in a tube, which has never really been, shall we say, a good seller because of the inconvenience of it. You talked about the tablets. Hey, that's perfect. You can put them in the purse. You can put them in your pocket, or whatever else. So we talked about treating low blood sugars, and if the only thing you have available is a candy bar, or maple syrup, or whatever.
You do it.
Don't delay. You got to use it, right?
You got it.
Okay. What about what are high blood sugars, and how do we really deal with them? There's so many meds in the marketplace nowadays, and oral tablets for the type 2 diabetic, and different types of insulin, that we didn't have. I grew up with beef and pork. And pork was the most pure, supposedly, way back in the 60s and 70s. So, but here we are nowadays with, laboratory-produced human insulins and things along that line.
Right.
Is anybody recommending? I don't even know if they're available anymore, the beef and pork stuff.
I don't think they are. I haven't seen them in years. They used to use them for animals for a while, but I think they have all sorts of human.
They just use regular.
Yeah.
And of course, one of the main issues is the cost of them. The insulin products now, they were, believe this or not, was 99 cents for the beef and pork.
Wow.
This was back in the 60s. Okay.
Wow.
And it was one of the cost competitive items that the big chains played with. Sometimes it'd be 49 cents. So for a little while. So, but we didn't have any human insulin then. So.
Right.
So that's kind of where we've come from on the insulins. I mean, it's just amazing. Pens.
Yes.
Some pens, things
It's very
like that.
makes it very convenient for them to carry it around, to not have to draw it up. They just dial their dose.
Yeah.
They do like that.
But they've gone price-wise to the other spectrum. I mean, they're
Yes,
just
that makes
off
it
the wall.
hard, and especially if you have couples in the household that are both using insulin. It makes it hard.
Sure. All right, so
So a high blood sugar, they would consider over 200. That's something, and they might have symptoms of increased thirst, increased urination, fatigue, blurred vision, different symptoms, or sometimes they might feel the same as if they were low. So it depends on the person with
and the
that.
symptoms of a high could be the same as
Yeah.
symptoms of a low.
Yeah.
Okay.
They might be silly, or, it just all depends on the person. But just be aware, and checking is key. That's something that I see when they come in. They don't check their blood sugar, and that's something that I educate.
Out of sight, out of mind.
Yes, yeah. So only if they feel, then they'll check.
Yeah,
So
yeah.
I really try to educate on that. How you can actually get a low, that's a big question that I ask too. They know how to treat a low, but they don't know how to treat a high.
Yeah.
So we talk about exercise, we talk about water. Water helps flush the blood sugar out. That really helps lower the blood sugar. Watching the carb intake, the carbohydrate intake that they are watching, what they eat, how much they eat per meal, and rechecking their blood sugar, making sure that blood sugar is coming down.
Okay. It's over the years, since I've been a pharmacist for a long time, things have dramatically changed. Like talking about the insulins and some of the new oral products that are out there and that sort of thing. Let's say we have a diabetic who's maybe either type 1 or type 2. How many times a day do you recommend them testing?
So that is I go by the physician and what their order is. Let's say they have not told them, but they want them to test. Then I gear it towards, what are you taking? If they're on strictly pills, say they're a metformin, once a day, twice a day, then it's a morning fasting. And then every once in a while I will tell them to check before dinner, every once in a while 2 hours after a meal, just to see how their medication is working and how they're doing. But if they're on insulin, that's a whole different ballgame. If they're on an insulin pump, they're testing more frequent to make sure. There's now insulin pumps now, though, that are more like our pancreas, and they don't have to test as often. That's just now coming out in the market. So there's, it's very specific, specific to the person.
I know one of the obstacles to testing is the cost. Okay.
Yes.
So here we are with our own product that's $7.95 or they're close for a pack of 50 strips, which is relatively inexpensive compared to some of the other testing products out there. Like one of the newer techniques, it's $120 a month. So I'm thinking, if you could get them to test, this is it. This is where you need to be.
That's it's when I was on the All Care side, like I had mentioned, this was a very important part of my job that would end up on my phone calls, was getting their meters. Where do I get my meters? How much is it? What can we do?
Yeah.
People, needed to be guided on how to and when. So it was very important to me, obviously, because at home I have the same situation. And this is key to knowing what's going on in your diabetic world, is testing. So.
Okay, first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Medicare open enrollment is going on now until December 7th, but selecting a plan can be confusing and stressful. That is why it is important to understand your options. We can help you figure out which plan is most economical for you. Call us and schedule an appointment to come in and have a free Medicare Part D plan consultation. Benefit from our pharmacist's knowledge, and you can save as much or more than $1,000 per year on your copays. Go to our website at medshoprx.com for more information. The Medicine Center Pharmacy's locally owned Health Mart Pharmacy in Canton, Louisville, Minerva, and New Philadelphia, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We're continuing our fantastic Black Friday deals at the Half Off and Hot Buy store in Louisville. Buy one, get one free 25-pound bags of sidewalk salt, and you're going to need it. Greeting cards are 10 for $1. Yes, that's just 10 cents each. Cell phone cases are 99 cents, and Dove bars of soap are now 2 for 99 cents. Be sure to check our toy section where you'll find an extra 20% off all toys. Grab some warm winter gloves for $5.99 a pair. These are just some of the deals at the Half Off and Hot Buy store in Louisville. Follow us on Facebook, Instagram, or visit halfoffhotbuy.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about diabetes care with diabetes educator Mechelle Metzgar. Have a question? Post it on our live Facebook feed.
Okay, we're having all kinds of good information this morning about diabetes. But I get asked in the pharmacy often, what causes type 2 diabetes? Why did I get this?
So there can be a number of things that can cause type 2 diabetes. Genetic is a big one a lot of times, and that's a big question that I ask during an assessment. Did your mother, father, any siblings have type 2? Lifestyle choices, sedentary lifestyle, how they're what they're eating, how they eat, weight, obesity, things like that can play a big part. And making just a few changes, it's insulin resistance is what happens. And when your body doesn't use the insulin as well as it should, insulin resistant is really that's the most common cause of type 2.
So for listener benefits, if you don't mind, insulin resistance. Your body makes enough insulin, but it doesn't use it as efficiently.
Right.
So as a result, your blood sugars go up, and you have either a diagnosis or symptoms of diabetes.
Right.
So there's things you can do when your pancreas is still working well to make insulin, and that's what you're talking about with some putting yourself in the best light with lifestyle modifications or maybe some medicines.
Yes.
They can help too. right?
Yes.
Okay. What about carbohydrates? Tell me what a carbohydrate is, and how about some good carbohydrates versus maybe poorer choices of carbohydrates?
So we nourish our body with proteins, carbohydrates, and fats. Carbohydrates are found in a lot of foods, some bad, some good. We want to make sure that we are nourishing it with good carbohydrates. Carbohydrates, fortunately and unfortunately, break down into glucose or sugar. So we need to make sure that we are finding the good carbohydrates, because some people, as soon as they come into the door, they say, I know, I'm not allowed to eat carbohydrates. And that's not true. We actually just have to know how much. Balance is key, and finding the good, healthy variety of foods. So your fruits, your vegetables, beans, and whole grains are what you want, and how much that you can have. So that's key.
And we're talking about, as far as bad carbohydrates, we're kind of talking about those refined things that are white.
Yes, white, yes, yeah, like white rice and white sandwiches and things like that.
So let's say
Pepsi and
let's say we can't handle a cup of coffee without sweetener in it. Okay. Is honey better or worse?
No honey.
Okay. Maple syrup, any of that stuff.
No.
Okay. All right.
No, but there are some. I mean, I don't really, as for some sweeteners, but some people do use some stevias and things like that. They find other avenues to do that. To find sweeten, and there's other things for their iced teas they can use, like lemon and fruits, things that sweeten naturally.
I think some of the artificial sweeteners, like stevia, that are out there are really excellent compared to what they used to be, like saccharin and the way back stuff, sucralose and all that kind of stuff. And frankly, I like Truvia myself.
Yes.
It's erythritol and something else in it. I forget what else is in it. Stevia, I guess. Yeah. So, they okay?
Mm-hmm. Yeah, I mean, those are better choices than, like you said, the others that were out way back in the day.
Didn't frankly taste good.
Yeah, right.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's MEDSHOPRX.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
You won't want to miss this upcoming Kiko Absolute Auction Wednesday, December 5th with auctioneer Bill Gill Jr. You'll find American Indian artwork prints, Jefferson Lamp antiques, collectibles, autographed sports memorabilia by Jim Brown and Joe DiMaggio, Gail Sayers, and others, trading cards, slot machines, antique furniture, and more. On-site and off-site bidding is offered. Mark your calendar for Wednesday, December 5th, starting at 3 p.m., at the Kiko Auction Gallery located at 3201 Parkway Street Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We're continuing our fantastic Black Friday deals at the Half Off and Hot Buy store in Louisville. Buy one, get one free 25-pound bags of sidewalk salt, and you're going to need it. Greet cards are 10 for $1. Yes, that's just 10 cents each. Cell phone cases are 99 cents, and Dove bars of soap are now 2 for 99 cents. Be sure to check our toy section where you'll find an extra 20% off all toys. Grab some warm winter gloves for $5.99 a pair. These are just some of the deals at the Half Off and Hot Buy store in Louisville. Follow us on Facebook, Instagram, or visit halfoffhotbuy.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Touch of drizzle. Temperature is hovering within a couple degrees of freezing. Watch for
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Excuse me. Today, we're talking about diabetes care with diabetes educator Mechelle Metzgar from Aultman Hospital. Got a lot more to cover this morning, so let's get back to the show.
Okay, let's talk about... We talked about type 2 diabetes and the causes, and we talked about good carbohydrates and poor choices in carbohydrates. What about fiber?
Fiber is an essential part of eating a healthy diet. And it promotes regularity, it keeps our blood pressure, our glucose or sugar levels, and our cholesterol in a healthy range. It can make you fuller, longer. Also, it can help with weight loss and maintaining the weight also. So it is good part of our, to make part of our diet. So include it.
Good for colon health too, right?
Yes,
So
yes, most
fiber.
definitely.
What kind of fiber? What are we going to... breakfast cereal. Which one's
so
the best?
you're great. Well, you don't want sweetened breakfast cereal. So most definitely the unsweetened. Cheerios is a fine cereal.
Okay.
Your fruits, your vegetables, your whole grains, those are where you're going to get your fibers from.
We don't want any sugar-coated cereal.
No.
We don't want to raise our children on
No.
sugar-coated. Do we now?
I have a niece who is 9 years old, and she does not get it in my house.
How about pancakes?
Yeah. Well, in moderation, but with the syrup, I mean, there are other things that you can put on your pancakes if you need. Sure. There's fresh fruits and things like that you can have with them.
There are sugar-free syrups.
There
too.
are.
You can get them in the restaurants. Almost all of them.
Yes,
have them.
and there's so many different sugar-frees. Before, back in years ago, they didn't really make any, and if they were like you said, the flavor or the.
I think I tried them once, and the current ones that are out, and I think they're okay.
Yeah.
Taste-wise, and they don't really ruin the product.
Yeah.
So.
But that maple syrup is right there on the list of right there by regular pop. It's a no-no.
Killer.
Yep.
Yeah, okay.
All right, so we're coming into the most wonderful time of the year.
Yes.
And probably the most tempting and challenging to maintain a disciplined diet. How do you recommend a patient with type 1 or type 2 diabetes navigate the temptations of the holiday season?
So, to balance out the blood sugars during the holiday, stick to your schedule as possible is key. Check your blood sugars frequently. Take your medications as directed. Don't leave home without your medication or your blood glucose meter. So, pack a bag, because when you get out there, you don't know if the weather's going to be like, if you get to Aunt Susie's and you're going to be gone all night, or you go traveling somewhere else. Make sure you're prepared. You have extra insulin or your pills just in case you might get stuck and need to stay overnight.
Keep your meds with you.
Yes, most definitely. Most definitely, Paul. Also, to help keep your blood sugars from changing, including the sweets as part of your carbohydrate budget. So, you're not going to have a huge amount of potatoes and rolls and stuffings and all this, and then also I want to indulge in pies and cookies and all that. Really be balanced. Again, I say that word balance again in key in carbohydrate counting. Be wise with what you're eating.
Any party you go to is going to have alcohol, sugar drinks,
Yes.
cookies, high sugared foods, et cetera, et cetera. So it's a tough one.
Right.
Start drinking water.
Right.
Tell people that they just
Right.
It's taken me a long time to get over the water thing, So.
Right. Very important.
So party smart is what we're talking about here, and I guess you walk in the room and you look around, and I got to find something I can eat or drink or whatever without pounding down the sugar.
Yeah, and the greatest thing that you can do when you're invited to a party is bring something that is going to be healthy, a healthy option, a vegetable tray, a veggie-based, appetizer or choice. One of your favorite things that that's going to be the majority of your plate. When we talk about the nutritional plate that you eat, the majority of what you eat is vegetable. The 50% of that plate should be vegetable. So fill up on that first, and then then you can fill up with your smart carb and your protein.
So let's talk about some of the snacks. Pretzels, good or bad? Chips, good or bad? Popcorn, good or bad?
Popcorn is okay. Your chips are going to be very high in sodium. And, baked chips, those can be 15 grams of carbs, your baked chips, and then the amount of them. So about 15 of them. So you have to watch which ones you choose.
Sure.
So choose the right ones.
What about breads? Okay, we know white bread is not the right thing. Okay, is rye better? Is wheat better?
It's the whole grain wheat in your rice, but make sure they say whole wheat, and they have that symbol on the back of your packaging. That is for sure that they have not taken out the wheat germ.
Okay.
When they're making it, that is the most important part of that bread source.
Okay. What about? I'm sorry. Go ahead.
No, I was just going to say, you just said something I think is important, and actually all of us can learn from, because you need to read your labels, but you need to understand what they're doing, because, just coming from a recent seminar that had some discussion about organic and non-genetically modified, there's like 15 or 20 different symbols people are throwing on packages, and some of them aren't necessarily for credentials, they're for looks.
Yep.
So you got to kind of do your math. Do you have anything to say about that?
Well, yeah, because there's huge label. It's a nutritional fact label. And when I am teaching, I tell them, look at how much is in the serving size, how much is the carb count of that serving size. And then we talked about fiber earlier in the show. Look at the fiber, because that's super important. We want a lot of fiber in our diet. And then if you're choosing a whole grain bread product, make sure it has that little wheat symbol. It's very small. It's about the size probably it's a square, and it's a nickel size, and it might be on the bottom of the product or on the back. And that just tells you that is certified, that they did not take out the wheat germ of it. And that's the important part of it.
What about common food? Burgers, okay, fried as to grilled.
So if you're going to have fried like fish and you have breading, when it's Lent and we have all those fish and so the breads, the fried portion of that has to be considered a bread.
Sure. Okay, now I like hamburgers. Okay. Does a grilled hamburger, cheeseburger, whatever, is it higher in fat content, obviously?
Yes.
But what about the other ingredients?
We want to have lean meats, preferably. It's better for our heart and it's also better for our weight, which then can help with not leading towards the road of diabetes and keeping us there. Our lean meats, chicken, fish, turkey. The beef portion of it and you're supposed to have the 3 ounces, the size of a deck of card when you're eating.
Okay.
Because if not, that's when we start. They have no carbohydrate allowance for that, so you don't have to count them as a carb, but you will have to count them as weight. They will start to put weight on you.
Okay.
You mentioned a deck of cards. Are we... I don't know if this is the right way to ask this question, but with respect to serving size,
Yes.
are we more just too accustomed to supersizing everything, or do manufacturers take shortcuts and make portion sizes smaller to make their product look better, or is it both?
Well, I had just recently, actually, my partner, Liz Heiser, we had done it was National Diabetes Month this November. We had done a display at Aultman and passed out apples and water and some education. And we had small apples, normal size apples, that we used to pick off trees when we were little, right? Those size apples. I had seen in the grocery store apples, and I talk about this with the patients, when I explain to them that apples are 15 grams for an apple of carbohydrates. Not the apples that they're size of cantaloupes. Have you seen them?
No, I haven't seen those.
They're huge. And our grapes now,
Are they Red Delicious, or are they a different...
just all different.
Okay.
And then our grapes are probably the size of a 50-cent piece.
Yeah, those new bread ones.
I said they're
they're
just
really
huge.
good.
And I bet. There are lots of carbs, too. So we have to really watch. No supersized fruits either. And wash your fruits, too. It's real important.
Okay, we're hearing about apples. Yeah, an apple a day keeps the doctor away. Remember that one?
Yes.
And oranges, I don't know what it is about those. But okay,
Orange is
there
good.
really a different kind of sugar in those
Yes,
fruits?
it's natural. It all came from the earth, and it was grown from trees, and that's how we should go back to. You know, we grew up from gardens, and growing it from gardens, that's how we should be eating, not out of a box and out of a can and sugared things.
Watermelon.
And sodium.
Cantaloupe.
Fine.
Okay. How much?
Well, portion control, and there is a measurement. I especially like to tell people, because bananas, everybody loves bananas, and they're easy to grab.
Yeah.
Bananas are 30 grams of carbohydrates. So
They're kind of on a downer nowadays. So.
yeah, so you got to, and I like to make a big fruit salad for my family, and then I portion it out, so we get lots of flavors of all fruits.
All right. The other vegetables: lettuce, carrots, celery. I'm told carrots are loaded with sugar.
They're just higher in carbs, so same thing with that. Just portion. You can have carrots.
I guess we're at the final break of the show. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
We're continuing our fantastic Black Friday deals at the Half Off and Hot Buy store in Louisville. Buy one, get one free 25-pound bags of sidewalk salt, and you're going to need it. Greeting cards are 10 for $1. Yes, that's just 10 cents each. Cell phone cases are 99 cents, and Dove bars of soap are now 2 for 99 cents. Be sure to check our toy section where you'll find an extra 20% off all toys. Grab some warm winter gloves for $5.99 a pair. These are just some of the deals at the Half Off and Hot Buy store in Louisville. Follow us on Facebook, Instagram, or visit halfoffhotbuy.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing diet, exercise, blood sugar levels with diabetes educator Mechelle Metzgar. Let's get back to the show. Where we at? Here we go. How about exercise? Okay, that's the thing people don't like to do. Okay.
So exercise does definitely make a difference. It can improve your blood sugar control, reduce your risk of heart disease and stroke, boost your overall fitness. It is crucial to track your blood sugars before and after activity. Sometimes during, depending how long your exercise regimen is. They say you should do 150 minutes a week, and you should actually work up to 10,000 steps a day if you can. It's real important. So having a walking app on your phone or a pedometer, something that you can actually count your steps and see how you're doing.
Okay. Just counting the steps, okay? Like, okay, I get out of my chair, I walk over to the kitchen, okay, I sit down, a little bit later I wake up or get up and
do something from point A to point B. Make 20 minutes out, 30 minutes out a day and say, I'm going to actually go to the gym, or I'm going to go walk around the mall and then get back in my car and go home.
Go home, okay.
You know, yep.
So if I tell you that I did 6,000 steps yesterday, but I didn't do them consistently.
Right. Yeah, it's very important that you have an exercise regimen. That will be helpful.
I may have walked out around the stores or whatever,
right.
or I didn't in and out of my car.
Not paced, right.
Okay. How about we talk about the complications of diabetes? What are the most common?
So most common long-term complications, related health problems, are damage to the large blood vessels, which are the heart, the brain, and the legs, which can possibly lead to heart disease, heart attack, stroke. This is where we want to prevent this from even happening. And our small vessels can cause problems to our eyes, our kidneys, feet, and our nerves, which eventually the high blood sugars, where people end up with having things called retinopathy, neuropathy, tingling in their hands and feet, eventually going on dialysis, things like that.
That's really disastrous.
Yeah.
What about, all right, so we've talked about some complications, we've talked about numbers. How about we end our conversations on a positive note and what you can do to take ownership of this condition to make sure that either you manage it more effectively or you can set yourself up for as low risk as possible to avoid the complications of diabetes that you just mentioned.
So how you can avoid it? Okay, so let's kind of start with type 1. Type 1 cannot be prevented. I know some people lump it all together. Diabetes is diabetes, and they are different. Type 1 cannot be prevented. It is the insulin-producing cells in their pancreas are destroyed by their own immune system. And no amount of sugar in their diet or lifestyle decisions have caused this to happen. It just happens. And they actually have to take insulin for the rest of their life to survive. So when they eat, they have to have insulin. They have to have long-term insulin in their body all the time because that's what we make on a regular basis. Type 2, you can, however, prevent it. That's the greatest part. I get so excited when someone comes in and if they're newly diagnosed, and I actually try to give them that boost and give them that encouragement because I get excited telling them that, yes, they will always be considered a type 2, but they can get it to the point where possibly going off their medication. I've seen it happen.
Yeah.
And I've had patients that it's happened to, and they get so excited when it happens just from making the changes. Exercise and eating right, staying healthy weight, and those well-balanced meals and being active. It's just, that's key.
Why haven't we solved this problem?
Just keep playing this over and over.
I mean, well, the technology
I
today,
know.
I mean, look at this thing, okay? Computer,
Right.
20, 30, 40 years ago, it filled a room, okay? And here it is in my hand. So I can't believe we haven't solved this.
It's been on the back burner, and now I think people are trying to really come forward and hopefully, but we have to make a difference. We have to do something for ourselves, and
All right, so today we've talked about benefits of diabetes education with someone like yourself at Aultman Hospital. We've talked about some dietary tips and recommendations. We've talked about the importance of testing. I guess I'd like to highlight as a medicine center aside, if you will, that don't let the price of testing your blood sugar be intimidating. We have a solution to help you with that. Don't get me wrong, there's all kinds of fancy, high-tech, really cool stuff out there, but they come with a price. And if you can afford it, great. If your insurance covers it, great. But we have a very affordable solution where we can offer you a free diabetes meter at no charge, and we can sell you a box of test strips for $8. I mean, $8 for 50. You can't beat it. It's cheaper than a cup of coffee. On a daily basis for some people, depending on what you get in it. So don't be afraid to stop in the medicine center pharmacies and ask us.
Yeah, we didn't talk about those coffees.
Yeah, 1,400 calories.
As a diet,
Don't do it.
As a supplement.
But there's solutions that you can monitor your blood sugar on a daily basis affordably. So don't be afraid to ask your medicine center pharmacist for some help on that.
And they're real easy. I was just telling them I had a patient come in and they actually needed a meter, and I was able because they're so generous to give me a few in the office, and I was able to open one up, show them how to use it. They were able to demonstrate back how to use it. It was very simplistic. It is really a good meter.
And it talks to you.
I was just going to say, talks to you. It's very easy to program too. I will tell you, talking with a lot of patients over the phone like I have in the past, that can be a tricky thing, the programming, making sure that a date and time
Even just the
is
date
set.
and time, yeah.
Sure.
Yeah, so.
Yeah.
Well, guys, we got about a minute left. Any special programs coming up? What do we do for the holidays? All that good stuff.
Yeah.
Okay.
Watch everything, be balanced, check your blood sugar, take your medicine, and come see us if you need us.
Okay. Thank you to our special guest today, diabetes educator Mechelle Metzgar from Aultman Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, Kiko Auctioneers and Realtors, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.